Thank you, Norman, and I'd like to express my sincere thanks to all the panellists for coming sometimes long distance, and also some of the panellists pretty close to the acute end of their healthcare journeys at the moment. So I really do appreciate you coming along. So as Norman said, and I agree with him, we are probably a fair way from where we want to be in this space, and I won't take up much time, but I just wanted to give you my reflections on why it is that not only clinicians, but more the system in both clinical care and research struggles a little bit with this concept of true partnership, engagement, public patient involvement. And when I reflected on this, I think it's significantly, to do with our training as healthcare professionals, be it clinicians, managers or researchers. We're educated to have an opinion, we're educated to offer that opinion, and I think we're less well educated in some of the aesthetics that are required to achieve the goal we're looking for in terms of genuine understanding. So I'm a neurologist, at least I used to be full-time neurologist, now I'm a part-time neurologist, but I still remember the letters from my GP colleagues, and there were some lessons in how I became, I think, a little better at this as a clinician. The letter would read, "Dear Doctor," sometimes say, "Please do the needful." I'm sure Dr. Parsons remembers those letters. However, most letters would say, "Mrs. Jones has felt dizzy for 5 years. She has vertigo. Please fix." So as a doctor, I'd go into dizziness mode, and I would just start to drill down into the issue. But of course, I learned after a little while that it wasn't the dizziness most of the time that's bothering Mrs. Jones, and I learned to ask the question, "Can you tell me how I can be of help?" as the first question. Might be the dizziness, might be something completely different. And I think clinicians learn this, and we generally get reasonably good at this at the individual patient level, but the further we go away from that personal interaction, the further we go back in the system as clinicians or researchers or managers, the more disconnected we are from the issues at hand. And I think that is something we need to talk about today. How can we become more connected? So we'll explore this. So we're going to explore, I think, what Clint Eastwood said, the good, the bad and the ugly, because I think we're going to be challenged here this afternoon. And as my good friend Mark Parsons sometimes says to me, and he'll remember this, he said to me, "Chris, a man's got to know his limitations." This is also a Clint Eastwood saying, and he wasn't talking about me taking on the director of Sphere here. He was talking really about how, as clinicians, we need to do this a lot more effectively. And Mark and I have talked, following on his journey, about many of the stories that he'll come out with, I'm sure, and I'm very grateful for him sharing those with us. So we have to do this in partnership, in true partnership, and I'll now hand back to Norman to take us through some of these stories that will set the scene for, hopefully, a new way of working together. Thanks.